we have continuing coverage tonight and also new information on our chief medical examiner, Adele Shaker.
His 6 News has learned that Dr. Adele Shaker has a second job, seeing living patients at a clinic in the 6 Points area. And that's sparking some concerns with county commissioners on whether he can effectively and responsibly do his job as an ME.
Our Taylor Alanis has been covering the story for us from the beginning. She starts with more on a recording that details Shaker's second job.
We talked to a scheduler here at the clinic that Shaker works at. Now, we didn't tell the person we were recording them, so we won't play that recording for you on air. But we did play it for county commissioners individually, and they say what they heard came as a surprise.
This is the first I've ever heard of him having any outside employment anywhere else.
Precinct 3 Commissioner John Mares is reacting to a scheduler at AccuHealth, a clinic on Staples near 6 Points. She's telling us that Dr. Adele Shaker is seeing patients. She says he's no longer accepting new patients, but will keep seeing his existing ones. Dr. Shaker has a license to prescribe Suboxone, a drug similar to methadone meant to treat people who are trying to wean off opioids or other controlled substances. That treatment is among many offered by AccuHealth. Nueces County Judge Barbara Canales says she doesn't recall a certain conversation about Shaker helping patients, but she knows he does.
If he said, hey, I'm involved with Suboxone, I would have said great, because again, what we need are more physicians who are willing to treat patients in our community.
All of this comes almost a year after the Nueces County Assistant District Attorney Angelica Hernandez brought up concerns with the medical examiner's office that affect ongoing criminal cases. She told the Commissioner's Court about delays and insufficient autopsy results from the ME's office.
What we're concerned about is the length of time. We're concerned about the quality of the reports. We're getting way too many findings of undetermined.
Hernandez looked at Shaker's autopsy reports dating back to 2018.
It is a systemic problem with regard to even just yesterday receiving autopsies that are over 5 months old.
Hernandez's assertions call into question whether Shaker's full-time job as an ME was adequate, much less doing a job outside of the county.
My expectation is we hire him to do a full-time job. He should do a full-time job.
Shaker's attorney, Chris Gale, says Shaker's agreement with the county allows him to work outside of the county as long as it doesn't interfere with his work at the ME's office. The county says that agreement was for his old position as deputy ME.
He has not been in that clinic for a couple of years. He is providing services, whether it's by Zoom or telephone.
A question we have, what would happen if Dr. Shaker had to perform an autopsy on a patient he was treating with Suboxone? Precinct Commissioner Robert Hernandez thinks that's problematic.
I would think that would be a conflict of interest, okay? If he's asked to perform an autopsy on a person that might have passed away on something that he suggested.
Canales claims it's not a conflict of interest.
We have the appropriate measures in place and protections through Dr. Fernandez to make certain that for any reason, if Dr. Shaker can't handle a case or if there should be a real conflict of interest.
She says in that situation, the county would find outside help to perform the autopsy. In an audio recording made by an employee at the ME's office last year, obtained and authenticated by Chris 6 News, Dr. Shaker acknowledges the problems in the office. The recording was shared with commissioners and Canales in September.
I leave the office at 2 a.m. Raul comes and leaves and say, hey, are you leaving, Adele? I said, no, Raul, you just go. I have to finish every day. I know I come late, but I do my job and I exceed the number of hours.
My biggest concern is that if you're a medical examiner, your time is short already. I can't imagine them have any free time even for themselves, much less to be able to run anything outside of that, any other additional medical practice, because that's just taking way more time, that slowing down results of those autopsies and getting, like I said, getting closure for families.
The Commissioner's Court is looking to create an administrative position here at the medical examiner's office and hire a deputy ME. Now, this is a developing story, and we will bring you more information as it comes to light. For 6 Investigates, I'm Taylor Alanis.